Hi, I'm Ansar, consultant orthopaedic and trauma surgeon. I'm going to talk to you about ultrasound. You're on the ultrasound page. Ultrasound is a little bit what it says on the tin. It's sound technology used at very high frequency, hence the name ultra, and it's similar to the technology used by bats, for instance, for echolocation. It generates a sound signal that bounces into an area, and it's very, very good at looking at soft tissues. What's the difference between or advantage of ultrasound to other modalities? One is it's dynamic, so you can look at it in real time. So it's something that we use commonly in clinic. It's a brilliant outpatient modality. All of the Pinnacle clinics have ultrasound imaging capabilities built into them. So we've got somebody that can use the machine and can tell you usually what the issue is. So they're very useful for diagnostics, but also beyond that, if you're providing a treatment plan, you can do a very targeted treatment to the core of the problem and deliver either injection or a treatment into that area, delivering whatever substance we want to put into that area to help. So ultrasound is really, really useful for treatment and for diagnostics. There's a slight disadvantage in the person who's using it does need to be highly trained, but I suppose that's to some extent all modalities of imaging. But in ultrasound, it takes quite a lot of practice to actually get very, very good at looking at images. So there is a degree of what we call operator error or operator dependence imaging issues available with ultrasound that is not necessarily as prevalent in some of the other modalities. I'm going to do a quick demo and just show you a quick idea of how ultrasound is used and how it can be used in clinic, and very, very quickly. Okay, so this is ultrasound gel being applied, and that allows the signal to be transferred from the ultrasound probe, which is this device. There are lots of versions of the probe available. This is a very high definition one. It's very good at looking at superficial tissues and soft tissues. So you apply that through onto the gel, the signal travels through into the tissue and starts to produce a signal on the screen. One of the disadvantages you can see is that we do actually have to touch the skin. So if you've got a very, very sensitive area, obviously it can be a problem if you've got somatization or sensitive skin for whatever reason. This does require touching, unlike some of the other imaging modalities where you take a picture but you're not touching anything. So just need to be aware of that. I'll just show the images now and where it can be useful. So hopefully you guys can see that now, and that's an ultrasound image. Okay, and I know it looks like 50 shades of grey, but to the experienced eye, you can start to see skin. You can see the gel on the outside there, and what you can see there in the middle there, nice round structure, and actually you can see a little bit of blood flow, just showing that I am alive. And that's a vein, and I can demonstrate that because veins squash quite easily, and you can see as I compress it, it disappears. So that's a vein. Just to the side of it there is a tendon, and as I move my thumb, you can see that tendon move. And this is one of the big advantages of ultrasound imaging, is that you can do dynamic imaging, so you can be able to move and manipulate things. I'm looking at it in that vein, for instance, in cross section currently, but actually I can just as easily turn it around, turn my probe around. I'm now looking at it in cross section. So that's the same vein now, but it's now running longitudinally. So you can see you can change the image dynamically from a sort of inline horizontal image looking along the length of something, where you can spin it around and look at it in cross section. So, and that's the same for a tendon, or when you're looking at a joint or attachments of tissue, you can start to see how all of these things actually relate to each other. And if someone's got like an impingement type pathology, again, that's a tendon there. As I move, you can see that tissue moving. I'm moving my fingers, so you're getting a dynamic shot of how the tendons actually move in that particular area that you're imaging. And so you can have the patient move, and if their pain starts in a particular spot or a particular movement, you can help try and pinpoint that pathology and see where the catching, if that's what the problem is happening. So that's sort of the usefulness and precision that ultrasound can provide. But also, should I need to get a needle into that vein, which is all of about 2 or 3 millimeters, it's only about a 3 millimeter vein. I know it looks large on the screen there. I can actually use a needle and, with a position of 1 millimeter or less, get right to where I want to be, whether it's on a vein or the edge of a tendon, or right down onto the bone. That hard white layer that you can sort of hopefully see a little bit of is actually the bone popping through a little bit deeper, where it gets very bright white just there on the right of your screen, and that's bone. So you can see the sort of interface of tissues and planes. It's very, very useful in clinic and dynamically. So that quick demonstration of ultrasound has hopefully shown you the value it can bring into a clinical consultation, but also for treatment and targeted precise treatment. It's routine for us to use that for all treatments, injectable treatments in particular. Pinnacle. You can book to have an ultrasound if you haven't had one done by contacting our admin team. We have ultrasounds available at most of our clinics with diagnostics diagnostic capabilities. If you have existing reports of ultrasounds available, please send them across. We can help use those to target a treatment, but we will often need to repeat them, particularly if they are out of date or done many months or even years ago, to just show what the current position is, provide a very specific targeted treatment plan for you. Ultrasound imaging is available at all of our centres. If you need imaging arranged, the admin team can help. Please contact us for further information.